Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and I am here today to provide the district's latest update on COVID-19. I will provide some general updates as well as an update on economic relief for residents and businesses. And then I will turn it over to Attorney General Carl Racine, who will share some information on consumer protections and other emergency protections for residents of the District of Columbia. In addition to the Attorney General, I am joined by our Deputy Mayor for Planning and Economic Development, John Falchicchio, the Director of the Department of Employment Services, Unique Morris Hughes, and the Director of the District's Department of Housing and Community Development, Polly Donaldson. This morning, we released our daily information on COVID-19 in D.C. We now have 4,106 confirmed cases in the district. And sadly, today, we report that 205 Washingtonians have succumbed to the virus. We continue to be very concerned about how dangerous this virus can be, particularly to people who have underlying health conditions like diabetes and high blood pressure. If you have these conditions, we really need you to stay at home and to seek medical attention if you notice that you don't feel well, if you don't feel right. If someone in your home has these conditions, you need to be staying at home as well. You can see from the numbers here that we still have work to do in terms of seeing a decline in new cases and to seeing that decline consistently. We're showing today new cases, new positive cases in the district going back to April the 21st. Many residents received a call from former First Lady Michelle Obama yesterday, as the general told me. He got one this morning, reminding you to stay at home and get tested if you have any symptoms of COVID-19. We encourage you to follow her advice, and we can see that it saves lives, and it will help us keep our numbers down in the district. Yesterday, I also announced that we have expanded our testing criteria again to include asymptomatic essential workers with a history of exposure to a person who's tested positive for COVID-19. So this includes our grocery store workers, our essential government employees, and other workers who are reporting to essential jobs out in the community. We were very pleased that so many people called us over the last several days. Several members of our council sent out a robocall on Friday and Monday, making clear to everyone that testing is free at our sites across the District of Columbia, and that there are two citywide sites at the United Medical Center and at UDC at Bertie Bacchus. And you can call for an appointment at one of those sites at 855-363-0333, 855-363-0333. So we continue to remind people how important it is to listen to your body. The symptoms of COVID-19 have expanded over the course of our response to this pandemic. The CDC just issued other symptoms to watch out for, so we want you to pay close attention to that. Last week, I also explained that in addition to expanding testing, we also need to expand our contact tracing abilities, and we are in the process of expanding our team at DOH from 65 up to 200 contact tracers. And eventually, we think that we will need 900 people doing this type of work for the district. The goal of contact tracing is to identify nearly all cases of COVID-19, isolate infected individuals, and find and alert their contacts, and then quarantine all the contacts. We've had a lot of interest from the community, and we are posting these job descriptions on our website today in 3 categories: investigators, lead investigators, and program managers. These are 13-month term positions in DC government, and we urge all of DC all DC residents interested to go to our careers.dc.gov to apply. This week, we also announced 2 ways that residents can get involved in Reopen DC Advisory Committee, the Reopen DC Advisory Committee's work. Tonight at 5 p.m., this evening, I should say, at 5 p.m., the committee will be hosting a virtual town hall today at 5 p.m., and you can RSVP for that town hall at coronavirus.dc.gov/reopendc. And we also invite residents, workers, and employers to take the Reopen DC survey and participate and share your thoughts about the committee's work. Our health experts, of course, are going to tell us when we can reopen our city safely, but the advisory committee is focused on creating plans for how we will reopen. And the more input we get from the community, the better and more informed we can expect our reopening phases to be. Of course, we are not waiting to begin our reopen process to offer as much relief as we can locally and share as much information about all of the federal efforts underway to provide economic relief to DC residents and businesses. We heard last week from the CFO the very devastating impact the pandemic has had on the district's revenues. We know that it closed vibrant businesses. It's driven almost 80,000 people to apply for unemployment and has created a $700 million gap in our current budget year. So I wanted to share what our latest experience with unemployment is. You will see that over the past month and a half, nearly 82,000 people have filed for unemployment, and over 41,000 claims totaling more than $138 million have been paid out. Just last week, a new category of workers was eligible to apply for unemployment, and those are 1099 workers, gig workers, and self-employed people. And now they are able to apply, and that's part of the reason why the number of people that you saw apply last week is almost 6,500 people. As of, and that was as of Friday, and that's referred to as pandemic unemployment assistance, which is a little bit different than traditional unemployment because 1099 workers were not eligible for that. Individuals receiving UI benefits can also begin filing for extended benefits today. Those are workers who are on traditional unemployment whose benefits had run out. They now qualify for an additional 13 weeks. You do need to go to the DOES website to apply for that additional 13 weeks. And workers who receive PUA and traditional unemployment insurance benefits will receive the additional $600 per week. And that's on top of the traditional unemployment or the pandemic unemployment assistance. The $600 is on top of that. So I want to thank DOES and the team and all DC workers who are filing their claims. I didn't bring my brochure, but there is a big brochure that answers a lot of questions, and it's on our website at coronavirus.dc.gov. I can't emphasize enough having all of the materials that you need and then applying because we don't want anybody to be spit out of the system or put into a fraud alert because they don't have all of the identifying information that they need. So please pay close attention to that. I want to talk a little bit now about some things that we have been able to pull together locally that will help some renters. And we know in just 2 days it will be May 1, where the rent's due, mortgages are due, and people, of course, are rightly concerned about all of those things. We know that some benefits have begun to flow, including the $1,200 payment from the IRS and the unemployment payments that have been made. So that on May 1st, rent continues to be due, but we want to remind everybody that no one can be evicted or late fees charged during this time. But we continue to encourage you to the best of your ability to stay current with your rent. Renters who know that they cannot make rent should reach out to their housing provider. The Department of Housing and Community Development's network of housing counseling agencies can also provide advice, and Director Donaldson can tell us more about that. And of course, the Office of the Tenant Advocate is always available to offer advice. Additionally, for homeowners who are concerned about being able to make their mortgage payments, we have guidance from many lenders on coronavirus.dc.gov, and we encourage you to take a look at that advice. We also have some new relief on the way. I want to thank Polly and her team for identifying $1.5 million to be made available, which will help about 400 low-income families pay their rent. The funds can be used retroactively and will cover at least 6 months of rent for those households. The money for this program is coming from federal home dollars, which are normally used for affordable housing projects and for home purchase assistance program. In helping these tenants pay rent, we can also ensure the long-term stability of some of our affordable housing providers that operate on very tight margins. We will be able to provide the applications for this assistance on May 11th, and we will be posting that information on coronavirus.dc.gov. Today, we also have some good news to share about the DC Small Business Recovery Microgrants. The Office of the Deputy Mayor for Planning and Economic Development received over 7,000 applications for these grants, and we know applicants are eager to hear back. I once again want to thank the Council for enabling this microgrants program, and Deputy Mayor Falchicchio and his team for working very diligently to pull together a program to review over 7,000 applications, and also to find more money to add to the program. We began with $25 million and have since been able to identify an additional $8 million for the program, $4 million from Events DC, and over $1 million from DHCD, and $3 million in federal funds. So by adding these funds, our intent is to support all qualified applicants in some way. And so later today, DMPED will begin notifying applicants, and that process will continue through May 8th. We look forward to getting this money out the door and into the hands of small business owners. So award notification letters, as I mentioned, will begin to go out today. And now, Attorney General Racine, I want to turn to you and thank you for your hard work over the course of the pandemic response and making sure that we are protecting DC residents and consumers during this pandemic. Thank you, Attorney General.
Good morning, and thank you very much, Mayor Bowser, for inviting the Office of Attorney General to appear with you today to give an update on several key areas. At the outset, let me share the condolences on behalf of my team at OAG for the 205 district residents, including district employees, of course. You know, we lost someone that we loved very much and worked for us, George Valentine. And the 4,100 members of our community who have been sickened. And of course, noting with Mr. Falchicchio's plate, which is full, of course, all the others who may not be medically hurt but are economically and severely hurt by the District of Columbia. I want to thank you for your leadership on this, and thank also the Council of the District of Columbia. Note the presence of many staff here who are, putting themselves at risk, of course, to be here, and also note the presence of several members of the press who are doing the same. OAG has been working virtually now for more than a month, but working really hard on core areas in our office's sweet spot, if you will. It's consumer protection, tenant protections, protections for workers, protecting vulnerable folks, including seniors, and of course paying a lot of attention with our law enforcement partners to public safety. Let me go through those areas one by one, but at the outset I've got to say it felt really good to get a call from the First Lady, First Lady Obama, this morning. It was both like a good cup of coffee and a warm hug. And I would note that as one heck of a PSA. Perhaps we'd have her also do another PSA to make sure that DC voters register and actually go ahead and go to the Board of Elections to get their ballots so they can mail in and safely and participate in these elections coming up. With regard to tenant protections, as Mayor Bowser outlined and really reinforces every single day, landlords are not permitted to evict tenants during the period of this emergency. Indeed, the court also led the way and is not hearing eviction cases, and you want to thank Chief Judge Morin for his leadership on that. Notwithstanding the clear laws and the reminders, I'm here to tell you that unfortunately we've seen nearly 24 instances where landlords have either sought to evict individuals or increase rents, if you can believe that. Thankfully, our team has been quite adroit and very aggressive in educating landlords and property management companies, as well as issuing cease and desist letters. I can tell you that all of those matters that have been brought to our attention have been resolved, with the exception of 2 matters that we're currently engaged with. In addition, there have been complaints around landlords and property management companies not properly sanitizing common areas. Again, I want to say that when brought to their attention, the landlords and management companies, in every instance except one that we're still pursuing, have in fact resolved the issues. So again, we're really happy that folks call us at 202-442-9828, and you can always email us at consumer.protection@dc.gov. Mayor, you and I spoke a couple of weeks back about nuisance properties, and I know you're always concerned about public safety. I want folks to know that we've investigated about 40 nuisance complaints, again, resolving most of them cooperatively with the owner or property management company doing what it takes to add additional lighting or fencing or security. And we filed 1 nuisance complaint around a property that we discussed on Good Hope Road.
Good.
And have another one that we're about to bring in court. One thing about the courts I should note, since I mentioned court twice, is that they've been quite active, though virtual. I mean, we're seeing a lot of the civil cases that we filed move in discovery as well as final decisions. And again, that's a product of the leadership in Superior Court as well as the D.C. Court of Appeals and the federal courts. On consumer protection front, we've received over 320 consumer complaints about price gouging issues with billings and refunds, and a whole bunch of robocalls and scam attempts. With respect to price gouging, we've received over 107 complaints. We've resolved the overwhelming majority of those, about 75, again with direct engagement with the merchant who comported their behavior to the law. And then we've sent another 20 cease and desist letters. These, interestingly, involve the smaller convenience stores not the larger convenience stores like CVS. These are corner stores, beauty supply shops, liquor stores. There are online sellers engaged in gouging, and others who are, really trying to make a profit on very essential matters and goods like disinfectants, hand sanitizers, gloves, masks, etc. We've also sought the assistance of the big platforms, most particularly Amazon, Facebook, Google, Walmart, and Craigslist, because they see a lot of activity on their platform, and I'm happy to report that they've been quite responsive in identifying consumer fraud in our jurisdiction. With regard to billing and refund complaints, the most persistent complaint we've received concerns gyms, and of course Washington Sports Club unfortunately has been the most popular club that has received the most complaints, I think for good reason. It would be the third time that we've almost sued Washington Sports Club. Finally, we got them to do the right thing. And I want to thank my colleagues in New York, Tish James, the Attorney General there, quite strong, and Attorney General Josh Shapiro for leading the way along with us to finally get the Washington Sports Club to stop bilking its members for services that they cannot enjoy. I do want to inform the public that we have received your complaints around child care services that may not be going on, yet folks are still billing you, and even threatening some DC residents that if they seek a stop pay, that they'll not have their slots for their child protected in the coming months. So we're quite active in that area and hope to have something to report in the next couple of weeks. Lastly, we started hearing from a lot of DC employees around concerns related to parking lots and parking spaces that they pay upwards to $240 a month for. That's $240 a month goes a long way these days when times are rough. And so we're engaging the parking owners in discussions around what's fair and what's not. In the debt collection area, the DC Council and the mayor strongly supported an arrest, if you will, stopping of any debt collection activity. We're active in this regard to ensure that people are not debt collecting, and of course we're trying as best we can to strengthen the language that we have already in legislation. We're going to issue a guidance later this week. We'll get it all out to you in regards to how consumers can protect themselves from illegal, unlawful, too aggressive debt collection efforts. A couple more points here on the consumer front. Unfortunately, with the number of deaths that we're having here in the District of Columbia as well as other jurisdictions, we're seeing a lot of folks who aren't accustomed to dealing with funeral services, having to deal with funeral services in a less than ideal scenario. We found that that's an occasion where emotion can sometimes lead folks to become vulnerable to being preyed upon. The average price for a funeral can vary from $975 or so upwards to $12,000. So there's a lot of play in that. We're quite active in that regard, and we've got guidance on how funeral homes should be conducting themselves, working very closely with DCRA on that. So I want to really thank DCRA for partnering. There are scams, and here's the deal with scams. Long and short of it is, no matter what the scenario is, a crisis or not, people are going to try to take your money. And it's more important now than ever to not do any business with people who you don't know or who haven't been recommended to you by a family member or someone you trust. This is not the time to establish a new relationship, particularly online or on the telephone. And we would caution people against providing their personal information to folks who they don't know or haven't done business with before. I'm going to wrap up by really focusing on worker protections that we're focused on, working hand in hand with the administration and making sure, of course, that workers are protected. In that regard, I should point out that we are looking at about a handful of businesses that may be operating when they are truly not an essential business. That's doubly wrong and harmful when they're not abiding by social distancing or basic norms like having gloves, masks, and sanitizers in their workplace. Hotline for workers, 202-442-9828. And with that, Mayor Bowser, I'm happy to conclude my remarks.
Thank you.
Thank you.
Thank you, General. We are available for questions, a couple rounds of questions. Questions? Sam?
Mr. Racine, particularly the funeral homes, I know you've been doing this for a while. What are you finding any particular issues where people are being overcharged, or what's the situation? Have you had any meetings with the funeral directors? What is the situation?
Sure. So let me again just to highlight and amplify the partnership with DCRA on this issue, and the council and the emergency legislation asked DCRA and the Office of Attorney General to work together to really get guidance out both to the funeral home directors as well as DC residents and consumers. Again, the variance in pricing is so huge, 10 times, that there's a lot of play there where sales folks might sell, for example, or push in-house goods like their own coffins, when in fact coffins are available, and consumers should be informed that they can buy a coffin from some other place, not just the funeral home. We also have a funeral home consumer bill of rights. It's got 10 items or areas that consumers should ask their funeral home director to provide. And it's that kind of information that we're focused on. We've got, I believe, 3 complaints as of last night, and we're working with the consumers and the funeral directors to really do the right thing here. Overwhelmingly, what we've seen is that most businesses, established businesses in DC, seek to do the right thing. It's the infrequent business that is not doing the right thing, and that's where we come in with DCRA.
Yes.
Do you have any information about whether you've gotten any complaints about parking garages that are charging workers who are not coming into the city?
We have, Paul, we started getting those just earlier this week. In fact, someone on a call that we had regarding an office matter raised the issue themselves. And then that prompted the question of, hey, how much are we paying? And I know exactly how much I pay. And everybody sort of said, yeah, we're paying the same thing. I think it's a real issue. And not unlike Jim's here, not to pick on the parking lot owners, but there's got to be some allowance where the law essentially precludes an individual from driving in for the purpose of work if they're not working in an essential business. And I think that folks will end up being reasonable, and we're happy to work with those businesses to get there.
So do you suggest that people who are being charged who are not coming in should get in touch with your office?
Let me give the number, 202-442-9828. If you've got any questions around those kinds of fees that you're being charged on a monthly basis that get debited from your accounts for services that you simply are not permitted to access.
And then if I can follow up, are you also getting any information about daycare providers that are still trying to charge families even though their children are not being taken there, and that they're even being threatened?
Sadly, we have. As I mentioned, we've got about a handful of complaints where there were, in fact, I'll call it a threat. It wasn't a threat to bodily harm, but it was a threat to lose your spot. As you know, daycare is in high demand, and demand is greater than supply oftentimes, particularly around daycares that are located near where DC residents live. And using that kind of power to demand payment or have a kid not be in daycare for when we come back to work, I would argue, and I think most courts would argue and believe, is completely inappropriate, and we'll be focused on that.
So can I just
Please,
follow up
Mark.
on that? So what is the current situation? I mean, you listed several really good examples. I think most notably
people who are being charged for parking spaces that they're not using, and people are being charged for childcare they're not using. Currently, right now, do they have to continue to pay those fees and risk, as you say, losing their spot, either parking or childcare?
These are challenging legal questions. We know, there's a force majeure, right, old French word, clause that basically says that one does not have to complete their contractual obligation if it's, against the law. Those clauses, I think, are very much in play when we have a, very strong and smart mayor's order to stay at home. And so I think those issues are ripe legal issues, and we're going to stand on the side of the consumer here.
Yes.
Yes, Mayor. I wanted to ask you a little bit about St. Elizabeth's Hospital. I understand there are like 9 patients and 2 staffers there who are dead, and that there was some court order over the weekend regarding the operation of the hospital. Can you tell us anything about how things have changed or may be changing, what your thoughts are as far as the...
I'm looking for my sheet here. Give me 1 second.
I'd be happy to talk about the court case.
Sure, thank you. I just wanted to be clear because, Sam, you threw out a couple of numbers. What were the numbers you mentioned again?
My understanding was that there are now 9 deaths at the hospital. 7 of them are patients, 2 are staffers. That's my understanding.
I don't believe that we have any staff deaths at St. Elizabeth's. Do I have that wrong? And I can
That's what I
confirm.
thought, well, anyway, obviously there are deaths there, and particularly with patients. And I understand a lawsuit about trying.
I'm gonna turn to the Attorney General to talk about the lawsuit.
Sure. Thanks for the question, Sam. In the lawsuit, plaintiffs have asked for a temporary restraining order, and that restraining order was granted in part and denied in part. What's important to really focus on are the issues there. And the issues really focused on whether or not all the patients should be quarantined, or whether, as St. Elizabeth's, I think, reasonably took the position that a mandatory quarantining of all mental health patients may not necessarily take into account their particular mental health issue and needs, and indeed isolation can exacerbate certain mental health conditions. The court did determine that all patients should be quarantined, but interestingly now the plaintiff's lawyers have indicated that they would like to discuss more the issue of whether mandatory quarantine of each patient is actually in that patient's best interest. Here's the deal. I mean, I think this is the case with the Department of Corrections litigation also. The District of Columbia very much wants to get it right. It wants to protect the residents. It wants to protect the employees. When a court process has been engaged, that means that the District of Columbia has been entirely cooperative with the court. In the case of the Department of Corrections, of course, there is a person who is an expert who has required the District of Columbia to follow certain conditions, and the Department of Corrections is endeavoring to totally follow that. And we do the same thing with respect to St. Elizabeth. These are serious issues, and I want to note that these issues are issues that are going on throughout the country. The District of Columbia wants to get it right.
Yes.
I have a question for Ms.
Dr. Morris Hughes.
These contact trace positions, I assume because they're 13-month, they're temporary. But I'd like to know whether they will have access to DC government benefits, and are these full or part-time positions?
Go ahead.
Yep, so we are working very closely with DCHR to help district residents apply and staff these positions. My understanding is that they're both full-time and a limited number of part-time positions. And I know more information is available on careers.dc.gov on how to apply and a description of the positions, all of the positions that are listed in the slide deck.
And they do provide benefits. The full-time positions,
Can we follow
full-time.
up? Can I follow up? Do you know how much those jobs pay, and are they work-from-home jobs?
I can't get at that level of detail with you, Mark, but on the position description, we'll describe the pay categories. And it is likely that they're both remote and in-person and in community.
And Mayor,
Yes.
if I can also follow up on that. So you want, or not want, but you think you may need as many as 900. Is there a point where you believe that if you are able to ramp up as a hiring to 200, that you may come to a conclusion that you're not going to need any more than that? Why are you saying you think you may need 900?
Well, we're looking at all of the sectors that we need to reopen and what our estimates are when people start coming back to work and what we can estimate levels of infection to be during a slow reopening. And so what is important is that we know this virus is going to be with us and that people will get infected, but how we identify them, isolate them, reach their contacts, and quarantine them will determine how successful we are in reopening so that we can keep the level of infection low, so that our hospital system can support those number of people who may get infected and some who really get infected. Now, keep in mind that any phased reopening is going to continue to tell people who are in vulnerable populations and vulnerable categories to continue to stay at home.
And then I saw a photograph over at Bertie Bacchus yesterday. It looked like you had quite a turnout there. Do you know how many people showed up for testing yesterday?
I think that we had the 300 appointments and something close to 150 people that went through. And so that we're going to continue our effort is always to overschedule because there's some fall off, but people both drove up and walked up to that site. So we continue to keep a close eye on both of the citywide sites and the numbers of people coming in. Yes, Bennett. Bennett from the Washington Post.
Hi, Mayor Bowser. I have three questions.
Okay.
To start off, what's the city's guidance for D.C. residents who were ill in February and are now testing positive for coronavirus antibodies with these new antibody tests?
The Department of Health is going to have to respond to that question. We're not settled, and I don't think the science or the medical experts are settled on what those antibody tests mean in terms of immunity or how reliable they are. So your question is a bit more complicated and requires more than they should do this or that. So let me have the Department of Health follow up with you.
Okay. And then the second one, can you respond to the concerns about naming Michael Chertoff as a co-chair of your Reopen DC advisory group, given the criticism of his record on responding to Hurricane Katrina?
I am very confident in Michael's leadership and knowing the district, knowing the federal agencies, and being able to lead pretty diverse sector subcommittees on how we reopen. I'm looking forward to working with him.
And then lastly, I have to ask this. Is the logo design on the contact trace force supposed to be similar to the United States Space Force?
I have nothing to do with the logo design, but thank you for noticing.
All right, that's all I have today.
Okay. Alberto from Telemundo. Alberto?
Yeah, can you hear me now?
I can.
Okay. Thank you everyone for your time, and I have a couple of questions today. So, in terms of the new rental assistance program, will all residents in the district, no matter their immigration status, be available to apply for that assistance? Also, I don't know if this is available or not yet, but what organizations are going to be assisting in that program? And my second question is, you're talking about contact tracers. Will the contact tracers, once the program is implemented, will they be asking immigration status to residents as well? I assume the answer is no, but just wanted to make sure. Thank you.
Just any DC government service or program, we are here to serve DC residents. We do not do the job of federal immigration authorities, and that will continue to be our approach. We will be asking people to tell us about what they've been doing for 14 days and who they've been talking to and where they've been. That is the nature of contact tracing, and in some ways it offends our sense of liberty, but we know that those types of, that is how those interviews go. So just know that our intent is to isolate infected individuals and their contacts so that they're not spreading the virus. And so let me turn to Polly to say a little bit more about the application that will become available on May 11th for rental assistance.
Yes, thank you. Thank you, Madam Mayor. We are going to be tapping our community-based organization Housing Counseling Network. Included in that is the Latino Economic Development Center, and they are will be one of those who will be servicing the applications at that time.
So could you answer his question as to whether people who are non-documented residents would be available to get money from this new fund for rental assistance?
These are federal funds from HUD, and we will abide by the HUD regulations regarding the home dollars for this particular phase of the program.
Is that a yes or a no?
I don't know, Mark, and I don't know that the application, excuse me, I don't know that the application has been completed. And I'm happy to follow. Has the application been completed?
No, it's not completed yet, so we will be looking at that.
We will share that when we have it. Yes.
So Mayor, you're going to have the town hall today. Can you tell us a little bit more about who's going to participate, how the public can get involved?
John, do you have the details about how people are calling in?
Sure. So folks can register by going to the coronavirus.dc.gov/reopendc. If they go to that website, there is a link to register for the teletown hall. We'll also broadcast it on the mayor's social media accounts as well as Channel 16. But the reason we ask folks to register is so that we could actually stay in contact with them after the telephone town hall as well. The other thing we're asking for residents, workers, and employers to do is to take a survey to give us feedback so that we can capture as much feedback as possible about how we should approach reopening DC. And then finally, what I would say is we will have different ways that people can engage. Telephone town halls, generally what we do is we present up front. So the mayor, as well as the chairs of the advisory group, and Andrew Trueblood, our Director of Planning, will give a presentation up front, as well as a presentation by DC Health, and then we'll allow for questions as well from the public.
So how long are you talking about?
We expect it to go about an hour.
Okay. And will the participants include Ambassador Rice and Secretary Chertoff?
Correct, the chairs.
Everybody will be in a virtual situation? Or?
Correct. It's a virtual town hall, so folks will be joining virtually, including residents, employees who work in DC, as well as business owners.
So people they'll be on the phone and they can watch
Correct.
as well. Is that correct? Okay.
Correct.
Yes.
I want to get back to the contact tracing force. I would assume that DC residents will get preference in terms of hiring. But non-DC residents, can they apply for these positions also?
Let me confirm that with our Department of Human Resources, and yes, DC residents are encouraged to apply. Yes.
Can I ask, you were very clear about the rental. You can't be evicted, you can't charge late fees. I'm wondering about mortgage payments. Is it the same for that? I know Attorney General, you said the courts aren't hearing. But can you be charged late fees on your mortgage payment right now? And then for either of those people, renters or mortgage payments, if they don't pay them, can it still be reported as a credit to their credit rating?
And the council's most recent legislation, I'm pretty sure, addressed reports to credit agencies, and I think there's also the 90-day period. I'm sorry, I'm not remembering all of it may be 30 days after the emergency ends, that all of the prohibitions on fees and reports is in place.
And then if I could ask about the micro grants, do you know how, so I'm guessing this extra money, I believe the mayor said now everybody who would have qualified will now be able to get something. Do you know the range of the grants and how many applications were approved and denied?
Yes, John, we want to talk a little bit more about the
Sure.
categories.
So we received feedback as we were going through the process of reviewing the applications that the best way to do this would be to actually make awards to all eligible applicants. And so what we did was we went back to see what other resources we might be able to pool, and that's why we went to partners at DHCD, also reached out to partners at Events DC under the leadership of Greg Odell and Max Brown to try to figure out how we could cobble together more resources. We also were able to identify through the mayor's leadership funds from the CARES Act direct aid to put in federal dollars into the program as well. And so when we did that, we were able to look at the pool of applicants. And so for folks who are independent contractors, sole proprietors, or self-employed, they'll get a micro grant of $1,000. And then the range for employers is between $2,500 and approximately $14,000. And what we're going to do is we're kind of into an award phase. So what DemPed will start doing today is notifying an initial batch of grantees, and then over the course of the next week and a half, notify all eligible grantees. We did have a couple hundred, several hundred folks who had an incomplete application. We're not shutting them out of the program either. We're going to be in touch with them too, so that they can give us the information that led to an incomplete application.
And so you'll notify them, when would they start seeing checks?
Sure. So it depends on how they want to receive the micro grant. They can either do it by a wire transfer, that takes about 1 to 2 days, and then a check takes about 7 to 14 days. So that's a big window. What we're doing is the grantees will get assigned to a community development financial institution, and that community development financial institution will go through their verification process as well as processing their payment.
Mayor, I wanted to ask you about, yesterday you expanded the testing for essential workers in the city and grocery store workers. But it had a slight caveat to it. It said that they had to prove that they had an exposure to a laboratory positive test patient. Do you think that was a little too stringent? Because you're putting the onus on these people to then prove that they had an exposure.
We want to make sure that people are getting tested who have been exposed to the virus, and they'll be asked a question about that.
Well, how do they prove it?
They're going to tell the people on the hotline whether they have or not.
But I mean, I'm just wondering, how do you prove that you've been exposed to somebody like that?
I just told you.
I don't understand.
They're going to tell the person on the hotline if they've been exposed.
I don't get it, but okay.
Okay, thanks everybody.